This reply is in reply to Faith, who posted about um, HIV, not HIV, herpes simplex virus 1 and 2. Her populations that she chose was the elderly versus pediatrics. Um, Faith, you did a really good job with your discussion about the herpes simplex virus. I learned a lot from your posts, such as that flare ups um, is when the virus is contagious. You stated that the virus is only contagious if the patient has a flare up. I think that it's a myth that no matter if you have a flare up or not, that you can still spread the virus. I have always thought that that was the case. Um, I like that you uh, gave percentages for the uh, prevalence in the elderly of the HSV1. You said it's about 50% of the elderly patients have HSV1 compared to about 12% having HSV2. Um, I like that you gave the analogy about people not letting uh, strangers or family members kiss their children, or not liking for them to kiss the babies because of how easy it is to spread HSV1. One thing I do want to point out is that most people who have cold sores, they are not going to try to kiss your baby with a cold sore. You can see when somebody has a cold sore. So if you have no problems with spreading it, if there's not a flare up, then people who like to kiss babies to fence, it shouldn't be a problem to kiss a baby unless you have a cold sore that is not able to be seen, which HSV1 is not only seen as a cold sore. You can also have what they call ulcers inside of your mouth that a lot of people cannot see. They can form on the gums, um, on the inside of your lip. So it's yeah, it's probably best that people don't let people kiss their babies. Anyway, um, I like that you mentioned how it's over 50% of the pediatric population that have HSV1, and that can come from anything from people kissing them to them drinking at the people to them touching stuff and putting their hands in their mouth. Just all kind of ways that poor babies can get the HSV1 virus. For the elderly people, you mentioned that they have a weakened immune system. I just want to add that so does the pediatric population. They are two of the most vulnerable populations is the elderly and the pediatric population. Um, you also mentioned the herpes encephalitis that affects elderly patients with symptoms such as headaches and muscle aches and fatigue. I thought that was very interesting. You also mentioned the possibility of fever with it as well. Encephalitis is basically just confusion, inflammation of the brain where it causes a lot of confusion, and that can be hard to um, differentiate between regular old just confusion in elderly patients because a lot of them have signs and symptoms of dementia. You have other forms of encephalopathy that can occur in the elderly. So I thought that was good that you mentioned that. One thing that I thought of when you were talking about babies being born with HSV too, that could possibly be very damaging and even be fatal to some, is that some babies are born blind due to the mother having an outbreak um, of the disease at the time. So it's important that we make sure that we inform the patients, especially the mothers who are with child, that they need to have their symptoms under control, or at least be absent of any outbreaks at the time of delivery, because if the baby passes through the vaginal canal while the mother has an outbreak, the baby could be born blind. I use the AACN Essential 2.9D, which says recognize when additional expertise and knowledge is needed to manage the patient. And I think that sometimes we know what to say and what to do, but as far as like herpes simplex virus 1 and 2 is concerned, maybe some additional networking may be required, maybe from infectious disease or sexually transmitted disease specialists, or somebody who works in the pediatric field that deals with patients with sexually transmitted diseases might be need to be brought in. But I think it did a great job.